More than 600,000 lives have now been lost to COVID-19 in the U.S. It comes as states are continuing to lift restrictions while pushing people to get vaccinated. Skyler Henry has the latest from Washington.
Just one day after marking the state's reopening, California Governor Gavin Newsom visited a Six Flags theme park in L.A. County, offering free tickets to the next 50,000 people who roll up their sleeves.
You get a single dose of vaccine, one of these 65 locations in 13 different counties, you will get a free ticket. You cannot sell that ticket. It is not transferable.
Governor Newsom rolled out this new incentive as the nation surpassed 600,000 deaths from COVID-19, despite progress in vaccinations.
Once you get enough people vaccinated, the virus is going to have no place to go.
The more contagious Delta variant now makes up about 10% of the cases in the U.S.
It's concerning because it spreads clearly more efficiently than the one that we've been normally dealing with, and it tends to look like it might even be more serious in making people ill.
At least 14 states and Washington, D.C. have hit President Biden's goal of having 70% of U.S. adults at least partially vaccinated by Independence Day. New York has already hit that benchmark, and throughout the state last night, fireworks shows lit up the sky marking the state's reopening. On Wednesday, New York City Mayor Bill de Blasio announced a new incentive for residents who haven't gotten a shot yet.
You sign up to get vaccinated, you can now win $2,500. Yes, $2,500 directly, debit cards.
Members of the Biden administration, including Vice President Harris and Second Gentleman Doug Emhoff, were tapped to make public appearances across the South this week to stress the importance of getting vaccinated. The vice president will end the tour with a visit to Atlanta on Friday. Skyler Henry, CBS News, Washington.
And CBS News reporter Alex Tin joins me now. He has been covering all angles of the pandemic. Hi there, Alex. So Dr. Anthony Fauci spoke about the Delta variant on CBS this morning earlier. He said if you're not vaccinated, you should be concerned. Do health officials have an idea of when it may be more widespread in the U.S.?
Yeah, well, to put it bluntly, and you heard Dr. Fauci talk a little bit about that in introduction, is how fast this variant has really grown in the United States. You know, just a few weeks ago, and the CDC every week they put out what are called nowcast projections. That takes the variant surveillance that they've done, which lags by a few weeks, and draws some projections, some estimates based on that to say, based on this information from a few weeks ago, we can estimate that certain variants are this percentage of the circulating virus in the country. And what we've seen is that based on this data, in just a few weeks, the B.1.617.2 variant, that's a sublineage of a variant that was first spotted in India. You heard Dr. Fauci referring to it as the so-called Delta variant, has really grown from 2% to 10%. And again, to put that in perspective, you compare that to the B.1.1.7 or the Alpha variant, that was that one that everyone was concerned about, faster spreading, more contagious. It came from, or at least was first spotted in the United Kingdom. That variant, which took months to establish dominance in the United States, is now being outpaced, at least based on these early projections, by B.1.617.2 or the so-called Delta variant. And that's a trend that we're seeing not just here in the United States, but all around the world. You know, I was listening to an NIH summit that happened, I think it was yesterday, and there was a scientist from the Los Alamos National Laboratories who has been tracking the variant spread, not just here in the United States, but all around the world, and really remarked at how this national and international surge in cases from this variant is not only outpacing B.1.1.7, but is likely on track to being the dominant variant in many parts of the world. And already, at least in some regions of the United States, could make up some 1 in 4 cases.
Well, on Tuesday, the National Institutes of Health said studies have shown the coronavirus was in the U.S. in December of 2019. How are health officials talking about this timeline, and are they looking to see if it was here even earlier than that?
Well, it was a really interesting study, and it's one that has built on a real growing body of research that has focused on this question, which is, when was SARS-CoV-2 first circulating in the United States, and when did the first outbreaks really begin? You know, again, think back to the early days of the pandemic. We thought the first cases back then were in New York and Seattle. Those were some of the first health systems to report cases, to track outbreaks, and a lot of the really, fragmented and rationed out testing resources and health resources and epidemic resources were all focused on these two places. And, you had quarantine restrictions and travel restrictions. But that picture gets more complicated when you look at studies like the one that just came out from these NIH researchers, which looked at blood samples that were collected from people back in January of last year and suggested that SARS-CoV-2 could have been circulating not just as early as December 2019, but in samples from people who lived in Wisconsin and Massachusetts. And again, just as a reminder, Wisconsin and Massachusetts very far away from Seattle and New York. That dramatically changes the picture of both how we think about those early days of the pandemic response, but also more research and more investigations that's going into things like looking at old samples collected from people back then to really figure out how did this virus first enter the country.
Right. So many open questions about that. Well, the CDC, we know, is set to meet Friday on rare cases of heart inflammation following doses of the Pfizer and Moderna mRNA vaccines. How many cases are they looking at?
Well, to put this in perspective, there are hundreds of cases they are looking at of reported heart inflammation following one of the two mRNA vaccines, Moderna or Pfizer. But that 100 figure that we're thinking about has to be put in further perspective because we know that there are many, many people every year who get heart inflammation and don't get a COVID-19 vaccine. That's been happening for years, and it's happening across all age groups. What is potentially an issue here, and is something we heard about at an FDA meeting that happened a few weeks ago, and that we're going to hear an update about, or at least they're saying they're going to provide us an update about this Friday at a CDC meeting of the agency's independent panel of vaccine advisors, is answering the question, how much is this increase in reports, of rare heart inflammation, especially among younger adults and teenagers, many of them who are men, how much of that is part of the regular expected so-called background rate that you would expect to see every year, regardless of whether they got a COVID-19 vaccination, and how many of these reports are potentially not just more serious, but potentially linked to the COVID-19 vaccine. Now, to be clear, while the CDC and FDA have said they are investigating these reports and are looking for this potential connection, and other health authorities abroad have also been looking at the same reports, nobody has said that this is a very serious issue. Most of these cases, with the exception of a handful of very small, rare cases within this rare subset, actually are hospitalized. And an even smaller number of those have really seen the most severe side effects, which is very different from the picture we saw, for example, with the Johnson & Johnson rare side effects earlier this year.
Right. All right, Alex Tin. Alex, thank you very much for that update. Really appreciate it.
Thank you.